Let's talk today about preparing a vial of testosterone for injection and how to actually give it. You're gonna need a couple of supplies. First, let's talk about the vial of testosterone. Testosterone typically comes in small 1 milliliter vials. The amount of testosterone in here is typically 200 milligrams in that 1 milliliter. It does say on vial itself. You're also going to need a needle, typically an 18 gauge needle that is used to draw the testosterone out of the vial itself with a syringe. Syringes come in 1 ml syringes or 3 ml syringes or 5 ml syringes. Hopefully the pharmacist does not give you 5 ml syringes. I would put those aside and ask for smaller syringes if that happens. The other thing you're gonna need are alcohol pads to wipe off both the testosterone vial itself and the injection site. The first thing you're going to do is take your testosterone vial and an alcohol pad and wipe the top of the vial. Prevents infection. Second, you're gonna take a syringe. Typically, it's a 1 cc syringe, and identify exactly how much of the syringe you're going to fill with the testosterone. So if you're going to inject 100 milligrams of testosterone, that is your weekly dose. That is 1/2 of a milliliter. So if you're on a syringe that has units, that's 50. If you're on a syringe that has them by fractions, it's 1/2 or 0.5. So we're gonna use this vial so you can see it for demonstration. This vial has 1 milliliter of solution in it. So you're going to first put a large gauge needle. Typically it's 18 gauge, it comes from the pharmacy. You're gonna attach it to the syringe itself with just a twist. Then you stick the needle through the top of the rubber stopper, turn it upside down, and pull exactly how much testosterone you need out of the vial. So in this situation, we're gonna pull 1/2 of a milliliter to there. It goes to the top black mark of the stopper of the plunger. That is the mark you use to identify how much you're drawing. Next, you're gonna remove this 18 gauge large needle. Please do not inject with this one, it hurts. The pharmacist will also give you smaller needles. I typically recommend either a 27 or even a 29 gauge, which is a small, short needle. You're gonna attach that needle to the top, just like you did the other one. Typically recommend either the top of the thigh, the hip itself, or even the front of the abdomen. Okay, the first thing we're going to do is clean our injection site with a little bit of alcohol. Then, again, remember we're gonna go into the fat layer, so we're gonna pinch a couple inches and expose some fat. And you're going to, like a dart, inject, push the needle through the skin quickly into fat, and then push the plunger until all of the medication and that little air bubble has gone into the fat. And pull out quickly and wipe off if needed. This can be a bit overwhelming if you're giving injections for the first time. I completely understand that. Please reach out to us. We can help walk you through it if you have any questions.